Hello everyone, welcome back to my channel. So in the last video we have discussed about the physical examination, in that identification data and the general appearance. If you didn't watch that video, first you go and watch that video and come to this video. Okay, so this is the continuation of that video. So in this we are going to discuss about the head to foot examination. Okay, the first one is head. So in the head, what all we will examine? The first one is the scalp. In the scalp, what you have to see, whether there is a presence of any dandruff, lice or any lesions. Okay, so bleeding like wounds type. Okay, that is called lesions. If it is not present, that scalp is called healthy scalp. If it is anything is present, that you have to write here. Then next is the hair distribution and the characteristics. So hair distribution means what? Whether the hair was distributed all over the head equally. Okay, so then characteristics means whether it is a thin, brittle, shiny, okay, color of the hair. So that all the characteristics of the hair, whether it is a short or a small, curly, shining. So that all. So this the hair, this will indicates the whether the patient is having any protein energy malnutrition or any blood disorders. Okay, so that all we will come to know about the with the hair distribution and the characteristics. Other than this, if you are finding anything, that you have to write here. Okay, and the next is eyes. In the eyes you have to see for in the eyebrows whether they are both are symmetrical or not in the size and shape, hair is distributed equally or not. That you have to see the eyebrows, whether it is in the same line, same equal line. Okay, then eyelashes, whether the hair was adequately present in there or not. Okay, whether that they're short or small. Then whether that eyelashes are directed towards the inward to the eye or outward. So that all you have to see in the eyelashes. In the eyelids, edema is present or lesions. Ptosis means like a drooping of the eyelids. Okay, that will indicates any cranial nerves damage. Okay, and that eyelids are protruding inward direction or outward direction. That also you have to see in the eyelids. Sclera means you have to see whether it is yellowish in discoloration or this red in color, which color it is present, that you have to write, whether it is swelling or discharge, like that. Okay, and the next is conjunctiva. The conjunctiva is what? Thin translucent membrane which is covered the sclera. So more or less both are same, but here what we will see in the presence of conjunctivitis, redness, watering eye, that all you will have to see whether present or not. Vision, whether the normal vision is there, that is 6/6, or diplopia, short-sightedness, long-sightedness, whether the patient will use the reading glasses or side glasses, that all you have to mention here. Pupils, so you have to see in the pupils what you will see, whether it is pinpointed, normal in shape, dilated or symmetrical, constricted or unequal is there, that pupils, that all you have to watch and you have to write here. Okay, that is about the eye. If other than this, if you are finding any abnormalities, that you have to write here. Then ears, in ear what you will see? Hearing ability. So like that you have to find out the hearing ability, and Weber test will be there. So with the help of that all you have to find out hearing ability. Then you have to see the examine the both the ears, right ear and the left ear, presence of the size, shape. Okay, that you have to write here. Then discharges, it means pus formation will be there, no? Pus or bleeding, whatever, cerumen, whichever it is, discharges are present, that characteristics you have to write here. Then pain, a patient is complaining any touch back by pulling inward, outward or backward of the external auricle, if the patient is complaining pain or not. So that you have to write here. Cerumen means that brown discharge wax. Okay, cerumen is, so whether it is normal in consistency or thick or dry, that you have to write here. If other than this, if you are finding any abnormalities, you have to write. Then other than the nose, In the nose, what you will see, nasal spectrum, whether it is equally unequally divided the nostrils of the nose. So that you have to see here. If the any presence of DNS, deviated nasal septum. Nasal polyps means like abnormal tissue growth is present in the nostrils or not, that you have to find out. Then discharges like epistaxis, like watery discharges, bleeding discharges, blood that is present or not. If it is present, what type of discharge is present, that you have to write. Other than this, abnormality, size, shape, color of the nose, that you have to write here. Then about the mouth, in the lips, what you will see, whether the lips are cracked, okay, color of the lips, okay, whether it is dry or means which indicates dehydration, that you have to see here, right here. Then gums, whether it is swollen or reddened, which indicates the gingivitis, halitosis is present or not, bad breath. So here you have to write that all. Then about teeth, you have to see the color of the teeth, is there plague is present, or plague means like yellow coated thing which present on the teeth. Okay, tanning means if the patients who will chew the tobacco, okay, or smoking, their teeth will be different. The tan formation will be there of that pan tobaccos, okay, that is present or not, you have to see. Then artificial dentures are present, or the original teeth, okay. Then dental caries you have to see. So that all you have to write here. Then tongue, whether it is coated or not, swollen is there, redness is there, that you have to write here. Other than this, if you are finding any abnormalities, that. So in the throat, you have to see the inflammations, like inflammation of the tonsils, or the area that redness is present or not, pus formation is there or not, and candidiasis, okay, that white coated thing around the mouth and the throat, neck region, okay. So that whether it is present or not, you have to find out and you have to write here. In the neck, what you will do in the inspection means like a swelling or masses, means stiffness, neck rigidity, you have to find out by palpating whether there is swelling is there, mass found, okay, that you have to write here. Swelling is present or mass formation, okay. Other than this, if you are forming, means you have to see the presence of the goiter or thyroid problem, thyroid issues, okay. Size and shape of the neck, that all you have to write here. Chest, in the chest, shape of the chest, how it is, whether it is a barrel chest or a means shape of the vertebral column also. By that also the shape of the chest will be different, whether the present of pectus excavatum or carinatum, pointed wise sternum will be present, okay. In the breast, what you have to see, size and mass, is anything is present or there. In the males, you have to find out gynecomastia is present or not. This discharges you will have to write here in the nipple, okay. Nipples, if there is any size is there, size of the nipples you have to see, areola is present or that, or the size and shape, color have to find out. Discharges, discharges from nipple, here you have to write whether there is any discharges of like pus, bleeding, ulcer formation is there, that you have to write here. Palpation, after palpating, mass, if you are finding any mass present or not, you have to say. Either axillary lymph nodes, in the axillary area also you have to find out lumps or mass is there. If it is present, you have to write present, any lumps if you are finding, okay. First you have to find out the abdominal girth, okay. And color also you have to see whether the color of the skin, how it is, whether it is a bluish in discoloration, pinkish color, normal, okay, like that. Skin texture, how it is, dry, cold to touch, clammy, okay. Any lesions, any cuts, is there any is there present or not, that you have to write here. Distension means due to the any presence of ascites, means gas or fluid accumulation. Tenderness means pain to touch, is there anything tenderness, which quadrant is present, that tenderness, that you have to write here. Visible movements, any movements are there, actually you will find the bowel movements will be there. If there any abdominal aorta pulsation is present, that you have to write here. In any abnormalities means umbilical discharges is present or not, is it protruding, whether it is in normal size, that other than that also if you are finding any abnormalities, you have to write here, okay. In the back, Back means same color, lesions is there or not. You have to write shape of the vertical bolum, that is scoliosis, lordiosis, that you have to write here. Other than this, if you are finding any observation, any abnormalities, you have to. Extremities we will see for the symmetric in size, shape, okay, whether it is normal or not, both the sides. Okay, color you have to check it out, muscle strength and the tone is present or not. Other than this, if you are finding any abnormalities, you have to write. So this is about the head to foot examination. In the next class, we will see the systemic examination.